Welcome everyone, and thank you so much for joining us for the 2026 Open Enrollment webinar. My name is Mariah Hawkins, and I'm joined today by my colleague, Ashley Anguiano. Together, we'll walk through everything you need to know to make the most of this year's open enrollment period. Open enrollment runs from November 1st through December 12th, and we're here to help you feel confident about the choices you make, whether that means sticking with your current plans or making some changes for the new year. Before we get started, we want to introduce the team behind the Insurance Plans Office at the UUA. We're led by Hugh Dennis and Richard Nugent. Hugh Dennis is our Deputy Director for Church Staff Finances and Insurance Plans Director. Richard Nugent is our Director of Church Staff Finances. Ashley Anguiano, who's co-presenting today, is our Insurance Plan Specialist, and I'm Mariah Hawkins, serving as your Insurance Plans Project Coordinator. Our team's focus is to make sure you and your families have access to high-quality, equitable benefits that reflect Unitarian Universalist values. Back in the 1980s, the UUA offered health insurance for congregational ministers through the Massachusetts Blue Cross plan, but as the AIDS epidemic deeply affected our clergy, premiums rose sharply. Ministers who had other options began to leave the plan, and eventually Massachusetts Blue Cross canceled it altogether. Fast forward to 2005, the Rev. Ralph Marrow, who was then serving as the UUA's Director of Church Staff Finances, learned about a consortium of denominations connected through the Church Benefits Association, or CBA. Together, these denominations purchase health insurance through Highmark Blue Cross Blue Shield. Each denomination designs its own benefits, but collectively, they gain access to favorable claims processing support and better rates. In 2006, the UUA decided to join this interfaith consortium. That same year, the UUA board voted to create the Employee Benefits Trust to oversee what would become the UUA Health Plan. The plan officially launched in 2007. Richard stepped in as the Church Staff Finances Director the following year in 2008. Here's what makes our plan unique. The UUA Health Plan is owned by the UUA. It's a self-insured plan, which means that in years when we generate a surplus, those funds are set aside, separate from the UUA's budget, to cover years when we may experience a deficit. Of course, the plan has evolved over time. Staffing reductions following COVID had a significant impact. Where we once had around 1,100 employees enrolled, we now have closer to 930 employees, plus their dependents. Even with those challenges, the UUA Health Plan continues to provide coverage that reflects our values of community care and shared responsibility. Thank you so much for being a part of our plan. So, what exactly is open enrollment? It's the one time each year when you can review your current benefits, make changes, or enroll in new coverage. It's also when you can add or remove dependents, like a spouse or child. Any changes you make now will take effect January 1st, 2026. Outside of this period, you can only make changes if you experience a qualified life event such as marriage, a new baby, a new job, or a loss of other coverage. Here are the key dates to remember. Open enrollment runs November 1st through December 12th, and any updates you make will take effect January 1st, 2026. We encourage everyone not to wait until the last minute and to take time to review your options early so you can make informed decisions. The UUA offers a wide range of benefits that support your health and financial well-being. These include health insurance, dental and vision, life and accidental death and dismemberment, long-term disability, and hospital and accident indemnity coverage. Our benefits are designed to be inclusive and equitable, ensuring every employee has access to coverage that supports their unique needs.
Let's dive into what's new for 2026. Firstly, there's a 19.5% increase in the base health premium rate. We know this might raise some concerns, so please feel free to reach out to us with any questions or concerns after our session. You can email us at insuranceplans@uua.org. Again, that's insuranceplans@uua.org. Next, we're switching to Delta Dental for our dental coverage starting January 1. We aim to provide better options for your dental care needs. We are also removing the pharmacy deductible from all prescription coverage with the exception of specialty medications. And lastly, we're offering a one-time open enrollment for both life and long-term disability. This is a great opportunity for employees who miss their enrollment window. We have several health plan options with Highmark Blue Cross Blue Shield. They include the standard PPO plan, also known as the Gold Plan, and high deductible plans in both silver and bronze tiers, with or without an HSA. Each plan offers unique benefits, so consider what best fits your needs. An HSA is a powerful tool providing a tax advantage way to save for medical expenses. You contribute pre-tax money, it grows tax-free, and withdrawals for qualified healthcare costs are also tax-free. It's important to note that HSAs are available only if you're enrolled in a high deductible health plan, silver or bronze. As we move to the next slide, we'll discuss whether an HSA is the right choice for you. As we explore whether an HSA might be right for you, let's consider 3 key advantages. First, HSAs are designed to pair with qualified high deductible health plans. These plans generally have lower monthly premiums but higher out-of-pocket cost. The HSA can help bridge this gap by covering qualified healthcare expenses. Second, portability is a significant benefit. You own your HSA, meaning it stays with you even if you change jobs, health plans, or retire. This flexibility allows you to manage your health expenses on your terms. Lastly, the triple tax savings are a considerable advantage. Contributions are pre-tax, the account grows tax-free, and withdrawals for qualified expenses are tax-free. This combination can lead to substantial savings over time. The long-term financial benefits of an HSA can be significant, especially if you're planning for future healthcare needs. Let's explore the standard PPO plan in detail. The individual deductible is set at $1,600 with an out-of-pocket maximum of $6,500. The plan is beneficial if you desire predictable cost. It offers copays for doctor visits and prescriptions, which means you have a clear understanding of your expenses each time you visit a healthcare provider. This plan is especially suitable for individuals who expect to have frequent medical visits or require management for chronic conditions. It's designed to provide comprehensive coverage for both pediatric and adult diagnostic services, including advanced imaging like MRIs and CAT scans. Preventative care is fully covered, ensuring that routine physical exams, immunizations, and screenings like mammograms and pap smears are accessible without additional cost. Remember, this plan is ideal if you anticipate ongoing care needs and want a straightforward approach to managing your healthcare costs. The high deductible silver plan comes paired with an optional HSA. The individual deductible is set at $3,000 with an out-of-pocket maximum of $6,500. Once you hit the deductible, the plan covers 85% of most in-network services. This makes it a solid choice if you're looking for a balance between savings and coverage. A key feature is the integrated prescription and medical deductible, simplifying your expenses. This plan is ideal for those who are generally healthy and don't expect frequent medical visits. It allows you to save on premiums while being prepared to pay more upfront if necessary. When paired with an HSA, it offers additional tax-free saving opportunities, making it even more appealing. Remember, understanding how these elements work together can significantly impact your healthcare budgeting and planning. Now, let's look at the high deductible bronze plan. First, it's important to note this plan offers the lowest monthly premiums, which can be a great advantage if you rarely use medical care. However, it comes with a $6,000 individual deductible and a $7,500 out-of-pocket maximum. Once that deductible is met, you'll receive 80% coverage for in-network services. Preventative care, such as physicals, immunizations, and well-woman exams, are covered at 100% in-network, ensuring you can maintain your well-being without additional cost. This plan is especially suitable if you're comfortable covering costs out of pocket for unexpected events and prefer to use insurance mainly for catastrophic coverage. We also offer a Medicare supplement plan. Medicare supplement plans, often known as Medigap, are designed to help cover costs that traditional Medicare doesn't fully pay for. Let's break down how it works. First, Medicare Part A and Part B will cover approximately 80% of your approved medical expenses. Then, the Medicare supplement plan steps in to help with the remaining 20%, which includes expenses like deductibles, coinsurance, and copays. Now, it's important to remember that the Medicare supplement plan is not a replacement for your existing Medicare coverage. Instead, it works alongside it, offering a more comprehensive safety net for your healthcare costs. As for eligibility, it's available through the UUA Health Plan to active employees and qualified retirees who are age 65 and over. To enroll, you must be enrolled in both Medicare Part A and B.
When using the health plan premium calculator, you'll select first which plan you wish to get a premium for, the bronze high deductible, silver high deductible, or the gold standard PPO plan. Next, you'll select the employee's year of birth, the coverage type, employee only, employee plus spouse, employee plus children, or full family, and then you will put the first 3 digits of the employee's zip code. Once you select the employee's zip code, you'll click on Calculate Total Monthly Premium. You'll see below what you will be billed for each month. Here's a quick example of how to use the premium calculator once it's available to figure out the dependent or employee portion of a full monthly premium. You'll start by selecting employee-only coverage and write down that number. Then change your selection to employee plus spouse, employee plus children, or family to see how the total changes. To find out how much is for your dependents, just subtract the employee-only amount from the total. For instance, if the employee-only coverage costs $500 per month and employee plus spouse coverage costs $700, that means $200 of the monthly premium is for your spouse. One of our updates this year is our transition from Guardian Dental to Delta Dental as our new dental provider starting January 1st, 2026. Delta Dental is the largest dental network in the United States, which means more providers will now be in network, and that translates directly to more savings for you. Here's the best part. Your premiums and benefits are staying the exact same. The only thing changing is the carrier. All members who are currently enrolled will automatically transition to Delta Dental, so there's no action required on your part. You'll also have access to the Delta Dental mobile app, where you can view your coverage, check claims, and find in-network providers quickly. It's a very user-friendly platform that puts all your dental information right at your fingertips. January 1st, 2026, you will also be receiving new physical ID cards for your dental coverage through Delta. Since the rates are staying the same as we transition to Delta Dental, the employee-only premium is $65 a month, employee plus one dependent is $130 per month, and the best value is full family, which is 3 or more people, for $150 a month. These rates include dental coverage through Delta Dental, and vision coverage remains the same through IMED, which means you're getting 2 benefits under 1 premium. It's a great value for those who want comprehensive coverage for routine care like cleanings and exams, plus protection for bigger services such as fillings, crowns, or orthodontics. If you enroll in dental insurance, you'll automatically receive vision coverage through IMED at no additional cost. Just keep in mind that dental and vision are managed by separate companies. Delta handles dental, while IMED provides your vision benefits. IMED's known for having one of the largest vision networks, which includes popular providers like LensCrafters, Target Optical, and many local optometrists. Also, in keeping with their Go Green initiative, IMED no longer mails physical ID cards. Instead, you'll receive a digital card through their online member portal. Once you log in, you can easily access your card, view your benefits, and find in-network eye doctors near you. It's a small change that makes managing your benefits easier and more environmentally friendly. Next up is Guardian Hospital Indemnity Insurance, which provides an extra layer of financial protection in case you're hospitalized. Even with good health insurance, hospital stays can come with unexpected costs, things like deductibles, copays, and travel expenses that add up quickly. This plan pays cash benefits directly to you, not to the hospital, so you can use the money however you need. For example, you could use it to cover your out-of-pocket medical expenses or even for non-medical needs like childcare, transportation, or household bills while you recover. It's a very flexible and affordable option that gives peace of mind during stressful times. Another big plus is the coverage is portable, meaning you can take it with you if you change jobs within the UUA community. Similar to the hospital plan, Guardian Accident Insurance offers cash benefits directly to you after a covered accident, whether that's a broken bone, a trip to the ER, or an unexpected injury. We all know accidents can happen anytime, and the medical costs can add up fast. This plan helps you handle those extra expenses that your primary insurance might not cover, like ambulance rides, x-rays, physical therapy, or time away from work. It's a great supplement to your medical and disability insurance, and like the hospital plan, it's also portable, so you can keep the coverage even if your employment status changes. Many employees choose to pair this with the hospital plan for more complete protection against life's what-ifs. Next, let's talk about two really important benefits, life insurance and long-term disability, both offered through Guardian. Our life insurance benefit provides coverage equal to 200% of your annual salary, up to a maximum of $200,000. For clergy, this includes your housing allowance. Now, as you age, the coverage adjusts slightly to account for actuarial risk. At age 65, the benefit becomes 60% of the original amount, and at age 70, it becomes 35%. Premiums are adjusted accordingly, so everything remains balanced. This benefit ensures that if the unexpected happens, your loved ones have financial support to help them through. It's one of those things that you hope you never need, but it provides real peace of mind knowing it's there. We're also holding a one-time open enrollment opportunity this year, meaning you can enroll in life or long-term disability during this open enrollment period. If you haven't reviewed your life insurance in a while, this is a great time to take another look. In addition, our long-term disability plan provides income replacement, covering 60% of your pre-disability salary if you're unable to work due to an illness or injury. For clergy, that includes your housing allowance as well. This coverage is crucial because it helps protect your income and maintain financial stability while you recover. It's one of those benefits that can make a major difference if life throws an unexpected curveball. I also want to highlight our Employee Assistance Program, which is available to all members who are enrolled in life or long-term disability insurance through Guardian. The EAP provides short-term counseling, financial and legal guidance, and resources for personal or family challenges. Whether you're managing stress, navigating work-life balance, or dealing with a difficult situation, the EAP is here to help, and it's free to use. It's an often overlooked benefit, but it can be incredibly valuable. Even a single call or counseling session can make a big difference in getting the support you need.
Now, let's review some frequently asked questions. When do I receive my ID cards? If you enroll in coverage during open enrollment, your coverage will start on January 1 of 2026. ID cards can take up to 10 business days to arrive, but it's important to note that you should receive your ID cards by January 1st. However, in the event that your physical cards haven't arrived, don't worry. You can conveniently access digital copies through your member portals. This ensures that you have uninterrupted access to your benefits. Once your physical ID cards arrive, you can start using them right away. Also note, Vision ID cards are digital only. What if I miss the open enrollment deadline? Our open enrollment period is quite firm, there's no wiggle room. Once it ends, it's closed. If you miss it, the key thing to remember is that you'll have to wait for two specific opportunities to enroll. First, a qualifying life event, such as loss of other coverage, or second, starting a new position as a new hire, which resets your eligibility window. As a reminder, open enrollment is held every November, and coverage is effective the first of the upcoming year. Do I need to re-enroll every year? The good news is you don't have to re-enroll every year. If you're happy with your current coverage and are not making any changes, your coverages will automatically carry over to the new plan year. This makes it super convenient for those who want to keep things simple and consistent. Remember though, if you do want to make any changes, open enrollment is your opportunity. How do I know if my doctor is in network? One of the most convenient tools available to you is the Highmark Provider Search tool, which you can access through your member portal. Once you've created a member account, the portal will automatically apply your specific plan details to the search. This makes it incredibly straightforward to see which providers are in network for you. Remember, having in-network providers can help you save on out-of-pocket costs, so it's a great idea to check before scheduling appointments. If you have any questions about using the tool or need guidance, feel free to reach out to us. What happens if I change plans mid-year? You can indeed make changes to your plan level during the year. However, it's important to note that this will reset your deductible. This means that any amounts you've already paid towards your deductible or out of pocket will start over. Now, while you have this flexibility, the optimal time to make such changes is at the end or beginning of the year, as that is when your benefits naturally reset. This approach helps ensure you maximize your benefits and avoid unnecessary expenses.